Malia Jensen. I'm board certified family physician. I'm located in Iowa. This is Tucker. Tucker is my co-host from heaven. I miss Tucker. Every day I miss Tucker, but I always like to introduce him on my weekends so you guys know all about him. He was a wonderful soul dog for me. So, all right, we will get started. It is Sunday. Happy Sunday. And today we had a listener question regarding migraines. And I thought we would maybe go over that. But as always, if you guys have comments, please don't hesitate to comment or to ask questions. This is your opportunity to ask medical questions. And we'll call it our live Q&A Sunday. Live Q&A. Make sure we don't have any questions hanging out. We are live on Instagram and Facebook right now, you guys. So please like and share. Look and see if you are subscribed. If you're not, please hit that subscribe button and start following for more information. I do reels during the week, and then every Saturday at 9 a.m. Central, we have a live stream, and every Sunday at 10 a.m. Central, we do a live stream. So how many women out there have migraines? And did these migraines get better or worse at menopause if you're in that age group? Estrogen, for the most part, is a neuroprotectant. It's neuroprotectant. It naturally dampens any type of neuroinflammation. It increases serotonin and it buffers receptors against glutamate. Now, if you recall, glutamate is excitatory and GABA is calming. If our brain is off and it's higher in glutamate receptors being stimulated versus the calming of the GABA receptors, we have hypervigilance. We have an overactive sympathetic nervous system. So when females still have estrogen on board, it buffers those receptors against glutamate excitotoxicity. So basically hyperglutamate activity, okay? If the woman reaches menopause and there is a permanent loss of estrogen from the ovaries and it's low enough, the baseline threshold for excitation actually goes down. So many menopausal women will have an increased amount of headaches or migraines because the estrogen is lower and the threshold for having a headache also goes down. In addition, as these women age, their hypothalamus ages. And so we lose the homeostatic balance that also controls the central nervous system and its reactivity or its hyperexcitability. So a lot of stuff going on. Anytime that we have a stress or some sort of trigger, it could be, anger, it could be irritability, it could be a major surgery, it could be retirement, anything that could stress your system. The hypothalamus can't handle it as well as it did when it was younger. Sleep is a major risk factor for everyone, as well as the postmenopausal female. When we get deep, restful sleep, the sympathetic nervous system can calm down. If we don't get this deep, restful sleep, then our brain remains hyperexcitable. Now, our brain goes through a bit of a car wash when we sleep at night. Just like the rest of our body has a way to get rid of waste products, that's through the lymphatic system. The lymphatic system from the neck down is the car wash, okay? It's constantly cleaning the body of waste, of debris, of toxins, of misfolded proteins, whatever it is. It's a cleaning system. Now, there are some people that have malfunction of the lymphatic system and could have lymphedema, which is just pooling of fluid in the tissue. And that's for another day talking about it. But I wanted to mention the car wash for our brain. That car wash for our brain is called the glymphatic system, GL, glymphatic system. And it's, I want to not make this so complicated, but basically the mechanism of action during wake time, the brain's interstitial space is restricted. The cells are really tight together. The brain cells are actually larger during the day. And when we go to sleep at night and we go into a deep non-REM sleep, so slow wave sleep, the interstitial space between the cells expands upwards to 60%. The brain cells actually shrink down and the space between the cells increases, which is amazing because it gives it room for the cerebrospinal fluid to come in and for that interstitial fluid to release all of the toxic waste. It cannot do it. It is impossible for the glymphatic system to work when there is not non-REM sleep. Deep non-REM sleep is required in order for the glymphatic system to work. The glymphatic system is highly sensitive to the sympathetic nervous system. If noradrenaline is elevated, adrenaline, noradrenaline, cortisol, that will block, so to speak, the glymphatic system. It stops it from working. So wakefulness and sympathetic nervous system dominance keeps noradrenaline high, which constricts that interstitial space. So it makes that space smaller and it shuts down any cerebrospinal fluid rushing in. So if you're going to bed and you're in a chronically elevated sympathetic nervous system, guess what? Your glymphatic system is not working. The hypervigilant, overactive sympathetic nervous system is blocking the glymphatic system. And anytime that in late life, we have problems with sleep, we have insomnia, these toxic metabolites, cytokines, lactate, misfolded proteins, interleukin-6, all of these inflammatory markers are building up. They remain trapped in the brain. It can only work in deep, slow wave sleep. Okay? And this is important. Do I know all of the consequences over years of not having the glymphatic system work? I'm not sure. And, those studies, I don't know if they are done, if there's any studies on that. I didn't look into that. The question that came up from the listener was in regards to migraines, postmenopausal, just had a hip replacement. And what happens is that the glymphatic system, because of the hyperstimulation of the nervous system, it basically just short circuits. And then that lights up the trigeminal nerve. And the trigeminal nerve can lead to migraines, increase in late life migraines. So it had really nothing to do with the estrogen. I mean, partly. But if there was a stress or that person is in chronic hyper overdrive, then they could experience late life increase in migraines, okay? Hopefully that answered that listener's question. If you are listening on YouTube right now, please hit that thumbs up. What do most people actually die of? Cardiovascular disease is the number one killer. Okay. Tahir is listening from India. Where are you guys listening from? What city, what state, what country? Tell me, are you guys having late life migraines? I mean, men can have this too. They have andropause, but they also decreasing the sleep cycle. That's why it's very important to be very rigid with your sleep cycle. And there, as we get older, people are staying up later and getting up earlier in the morning. We really need to focus on going to sleep when it gets dark and then getting up when the sun comes up. So staying up until the sun is going down and then getting up and going outside when the sun is coming up, that will reset your circadian rhythm and will help with your sleep cycle. It's very important. I mean, many diseases, whether it be of the brain, Alzheimer's, dementias, MS, all those things. Sleep is a huge part of it, okay? The lymphatic system has to work if we want to decrease the accumulation of all of these toxins. KB is listening from Sacramento. Thanks for being here, KB. Again, where are you guys listening from? We are live on Instagram. Let's see. LR, or is it IR? Erickson is listening from Minneapolis. Thanks for being here. We are on Instagram and YouTube. We have a live fundraiser for rescue, rehab, and rehome. It's a rescue for dogs. That's where I got Buddy and Tallow. And they do wonderful work. And hopefully you will donate a couple dollars if you can. I really appreciate it. Yesterday we did very well. My goal was $100 and we made $118.83 for rescue, rehab, and rehome. I notified them this morning to watch for that to come in at the end of the month. So I want to thank you guys, Beverly and Allison. That was awesome of you guys and Leslie, thank you. I want to just thank you guys for supporting that rescue. That means a lot to me. Lindsay is listening from Oakville, Ontario. Welcome, Lindsay. Thank you for being here. Chicken Tonight is listening from London. Oh, the neck veins. Well, thank you, Sherry. I guess I wouldn't have noticed that. Henry says, yes, migraines started in the mid-40s. Greatly reduced caffeine has reduced them greatly. And yeah, I mean, that's a blood flow thing, so it's a little bit different. Although when we have good blood flow, the pulsatile nature of the blood flowing through the arteries will activate the lymphatic system or the glymphatic system in our brain. So we have to have them both working simultaneously, obviously. But yeah, reducing caffeine because caffeine is a vasoconstrictor. When you vasoconstrict, you actually you block blood flow and most cases, you stop the migraine from happening or the headache from happening. But when it wears off, the arteries vasodilate rapidly, causes a rush of blood flow, and that is one of the causes of headaches. John, that's a good question. I don't know what age most people are dying at. Maybe you can look that up and let us know. Okay. Any questions? Any questions on migraines? You guys are talking about, you're talking about life expectancy. Life expectancy has definitely increased, I would say, because modern medicine is keeping people alive longer. However, we're remaining, we're living longer, but we have more chronic diseases. I would say that 75% of that is from what we put in our mouth, our diet. That is what is leading to a lot of the problems that we have right now. And unfortunately, modern medicine has a pill for every ill, and we are just using whack-a-mole medicine. So we give a medicine for blood pressure, it causes this side effect. We give them a medicine for the side effect, which causes a side effect. We give another medicine. It's really too bad. You like pills, huh, Jared? Really? That surprises me. I have another question for you guys. How many of you are on GLPs? Jason. But if you get a severe migraine, a doctor told me they do not take aspirin, so it will cause ulcers. Then the doctor told me it's okay to drink coffee because of the caffeine. It sounds like whack-a-mole medicine, doesn't it, Jason? I'm not sure that the doctors actually know the mechanism of action of why migraines or headaches even begin. And, there's numerous causes of headaches. It's not that the caffeine is the problem while you're drinking it. It's when it's wearing off. It causes vasodilatation. So when it wears off, the arteries will vasodilate and blood rushes into an area that's already congested. And that's why headaches are more prevalent. So it's the wearing off of the caffeine. So that doctor is likely recommending that you just stay on caffeine full time so you don't have headaches. Not a really good plan of action. Yeah, I would agree, Henry. They're living longer due to the medications, but their quality of life in the last 10 to 20 years is poor. But that's where the nursing homes come in. They're making big bucks on you getting old. Isn't that crazy? What is a GLP? GLP is a hormone that is produced in our gut, and that hormone helps with satiety, helps us know when we are full. When we are obese or type 2 diabetic, our GLP naturally goes down. So a class of drugs called the GLPs or the GLP-GIP or the GLP-GIP glucagon, they are medications that stimulate hormones that help us lose weight because it blocks our hunger signals. It slows gastric emptying, so our food stays in our stomach longer, and people lose weight. They eat less. They might not change what they eat, which is a problem, but they do eat less. Okay. Common sense says, I have an infected tooth. It moved into my jaw. Feels like I'm dying. What can I do? You need to see your dentist. You go to your dentist or your orthodontist. Or if it's really bad, you go to the emergency room. And then they will call an oral surgeon and they can take care of your tooth. Yeah, that's right. Just see a dentist, common sense. Clash says just use some pliers. I like it. Let's see. If you have a question, put a Q in front of it so I can point it out because you guys got a lot of... Lisa says she's on the fence on taking a GLP, side effect fear. I'd be a little concerned as well. I mean, there are numerous side effects from going blind to gastric paralysis to death. So yeah, I would look into it. I would ask myself, why would I need a GLP? If the answer is I'm overweight, what is causing you to be overweight? Instead of adding medications, why don't we take away what is causing our problem? That is my philosophy. Let's see. John, your guess is as good as mine. If Jesus comes to get us before then, we are not going to be here in 500 years. Okay. Erickson says, yes, your philosophy, he or she's philosophy. Exactly. Pash uses GLP at the very tiny microdose to control epileptic seizures. I have no side effects and it has completely changed my life. So you're using that particular medication off label. Which one are you using? Is it semaglutide? Which one are you using? And is that an off label use of a GLP? 0.05. 0.025 is the lowest dose. Erickson asks, what are my thoughts on statins? For what? What do you need a statin for? What's the question? Instead of me just talking about statins, which I did yesterday, what is your question in regards to statins? What would you need a statin for? Pash, you're on a GLP GIP, so you're on Mounjaro or Zepbound. So Erickson is replying, high cholesterol. Well, what is the problem with your cholesterol? Why is it high? How do you know it's high? Who told you it was high? What is the upper limits of high? Who measures cholesterol? You cannot measure cholesterol in the blood. It is a fat and blood is water soluble. So you can't just go and measure cholesterol. Cholesterol is carried in lipoproteins. Okay? Lipoproteins like LDL, low density lipoproteins, intermediate density lipoproteins, high density lipoproteins, very low density lipoproteins. Okay. Looks like we do not have, Lucy's not here yet. If you have a medical question, put a QQQ in front of it and I will answer it. Otherwise, I'm not going to comment on your comments. Okay? Thank you. Good morning, Mark. Thank you for being here. I'm trying to scan through. Let's see. We're going to have to do my own moderating here. So we'll clean up some of this stuff for you guys over there on YouTube. Thank you. McCong says hearing health is brain health. Tell me about that. Pash says GLPs are often dangerous because they are being used in high doses and people are not getting support info on how to keep their terrain. Yeah, I don't think there is a lot of education going on as far as the GLPs are concerned. We have weight loss clinics here in the Des Moines area. I'm not sure that people are learning really how to eat. They're not learning how to exercise. I think that there's a lot of incentive to put people on medication and to lose weight. People don't even know what kind of weight they're losing, but they're losing bone weight, they're losing muscle weight, and fat weight is probably one of the last things to go because they don't change their diet. They're still eating carbohydrates. Carbohydrates raise blood sugar raises insulin. Insulin is a potent stimulator of fat cell hypertrophy. It grows fat cells, it grows cancer cells, it grows all kinds of cells. That's what insulin does. It is a growth type hormone. We are not educating our patients. We have people using GLPs who have 5 pounds to lose. 5 pounds. I mean, that could be just a really good bowel movement. Yet the doctors are putting them, writing prescriptions for GLPs. And if you have a legit doctor who says you don't need a GLP, people can go online and buy it from Hers or Hims or Row or wherever, and they just go get a GLP. Like I'm not sure that people are not understanding the ramifications of these medications. We do not know. You're using high doses of these medications and they've never been studied. People using these medications are the guinea pigs. They're in the study right now. Tracy says, QQQ, type 1 son, normal weight. What is the question, Tracy? Let me know. Okay, Pash says, at a microdose that I'm on, I don't lose weight and I don't lose my appetite because your body is used to it. That's why people eat through low dose GLP, okay? Or else if GLP was so high in our own body, nobody would be eating. So, Coach says GLPs without proper education in areas of nutrition and exercise is definitely a mistake. I would agree with you, Coach. I mean, you're right. Lifestyle modification over peptides always. And I'm sure, Coach, you are talking to your clients about that. And honestly, tell me, are you able to legally talk to your clients about nutrition? Do you have to have a degree to talk nutrition? And the only reason I ask is because I've had personal trainers, at my gym, and I'll say, hey, do you talk to your clients about their diet? And he goes, oh no, we can't do that because we're not trained. And I'll say, yeah, doctors aren't trained either. They probably have maybe 6 hours of nutrition in a four-year time period. So how can a doctor be qualified to give anybody advice without proper training? Tracy says, son, type 1, normal weight, on Dr. Bernstein diet. I don't know what that is. He's 11, on low carb, whole veggie, meat, dairy, low processed food. His endo wants him on a statin. His LDL is 507. A1C is 5.4. I would need more labs, Tracy, but a low carb, whole veggie, I'm hoping you're cooking them, because raw veg is very high in oxalates, phytates, tannins, saponins, all of these things that are decreasing the absorption of his amino acids, his B vitamins, calcium, magnesium, zinc, selenium, iron, okay? So he's 11 years old. I don't know what he's eating. He's eating meat and dairy and low processed food, okay? What is his HDL? What is his triglyceride? What is his small dense LDLs? What is his oxidized LDL? What is his LP little a? Before you go and put an 11-year-old on a statin, why is his LDL at 507? Is he eating sticks of butter during the day? Does he have an LDL receptor problem on his liver? Does he have a PCSK9 problem? Was he born with a PCSK9 problem? Does he have NPC1L1 hyperabsorber problem? Because you don't just put somebody on a statin, no matter what age they are, but if you really want to keep a kid, an 11-year-old, on a statin for the rest of their life, you probably will have to expect that they're going to have early Alzheimer's, diabetes, they're going to have muscle aches and pains. It could decrease their growth. I'm not sure, but it sounds like it could. This is real. I'm having really, I can't believe an endo would jump to a statin like that. Without asking any questions. But again, Tracy, I'm not your doctor. I'm not his doctor. I'm here for information purposes only. He eats raw cucumbers and salads. I would probably cook that stuff. Yeah, raw veg is very high in phytates and oxalates. Nana asks, I have a calcium score test result of 19.8. Left main is 0. The left anterior descending is all of it. So it's all in your 19.8 is all in the left anterior descending. Okay. Calcified plaque. Nana, I can't remember how old you are and when was your previous one prior to that. Do you have another record of what your calcium score was years ago, a year ago, 2 years ago? Okay. What was your result? As we age, the calcium score will go up. Okay. It just will. Again, did somebody recommend that you do something with that 19.8? What is your HDL or triglyceride to HDL ratio? What is your insulin level? Tracy, I would also get an insulin level on your son. I forgot to mention that. HDL is 55, triglycerides are 80, LP little a is 20. So that triglyceride level of 80 might be a bit high. So he's got some metabolic stuff going on. That 500, or excuse me, that LDL of 500 could be a lot of VLDLs, okay? We don't know what his VLDL count is. But this would be, again, Tracy, no matter what age he is, if it was you, Tracy, and you had a 500 LDL, I would look into it. And since he is your son, what is your LDL? What is your husband's LDL? Is there familial hyperlipidemia? At this point, I'm actually doubting it. And his diet that is high in saturated fat is the cause of the LDL at 500. Okay. I don't know. I'm speculating, but I would definitely look into it. If he was a hyperabsorber and he was an NPC1L1, just hear me out here, Tracy. Let's say he was a hyperabsorber and his NPC1L1 receptor or that activity in his gut was high. So he is recirculating all of the LDL. Instead of pooping it out, he's actually putting it back into his bloodstream via the NPC1L1 receptor. He's a hyperabsorber. I don't know. Let's just say that, okay? If you put him on a statin, it will starve his hepatic, if he is an NPC1L1 hyperabsorber. You don't put somebody like that on a statin because a statin blocks the mevalonate pathway. Our cells, like the hepatocytes, the liver cells, also have a mevalonate pathway. And so if you give a statin, it will block the production of cholesterol in the liver, in the hepatocytes. Guess what? They will go overboard. They will be starving for cholesterol, so start outputting a bunch of cholesterol. So his LDL could actually go up on a statin if he's a hyperabsorber. If that makes sense. Also, people who are NPC1L1 hyperabsorbers have an increased risk of Alzheimer's disease. You check their ApoE4 and it will be elevated. So another thing to check, Tracy. And do you want to actually give a statin that blocks cholesterol production in a hyperabsorber who also is at risk for dementia, for Alzheimer's? You would never do that. I would never do that. Okay, I would never give a kid that blocks fat and cholesterol for their brain and their body, all of their cells, and knowing that they're an NPC1L1 hyperabsorber. Yeah, I couldn't do it because the chances of him having a positive ApoE4 gene is pretty high. I would check it. Okay, if any of you are NPC1L1 hyperabsorbers, get an ApoE4 gene, okay? And let me know. Rose asks, I'm a bad sleeper, but I'm scared of sleeping pills. Any advice besides sleep hygiene? Sleep hygiene is most important. So being consistent with going to sleep and getting up. So exact same hours, training your body the exact same hours, trying to go to sleep shortly after the sun goes down and getting up when the sun comes up. Okay, that's very important. Not eating 2-3 hours before you go to bed. If you have problems in the middle of the night waking up, that could be because your liver is pumping out a bunch of glucose because of cortisol. So if you go to bed and your blood sugars drop down because you've fasted or you're on a carnivore diet, there are certain people, their blood sugar will go down in the middle of the night. The brain senses that as an emergency. So it kicks in the liver to make glucose for the brain. And when the brain senses an emergency, it releases cortisol that will wake you up and you can't go back to sleep. Those are just some of the things that could be going on. But sympathetic overdrive, hyper vigilant people who have poor sleep can sometimes get benefit from taking GABA 1 hour before bedtime. Also adding glycine, 3 grams of glycine prior to 1 hour before going to bed. I do not prefer to use L-tryptophan or melatonin, valerian root. I just don't recommend those. We need to actually decrease sympathetic tone and increase parasympathetic tone. So doing breathing exercises and other parasympathetic exercises prior to going to bed and through the day is in our best interest. Nana says, calcium score test question, I'm 69. Okay. 12 years ago it was 2. So what is that percentage increase, Nana, in 12 years? So 2 divided by 19.8. What is that percentage of increase? That it's not very high. You're 69 years old and you've only gone up to 12, which could just be natural aging. I mean, yeah, Tracy, I understand if it's APO. ApoB is just a particle count, okay? All right, so I would be happy to look over his labs and recommend certain tests. I don't know his history. You can sign up for a consultation. I would be happy to walk through what I would do and what tests I would get and what I look at. I would need to know his liver function and his white blood cell count, red blood cell count. There's a lot of labs that I would probably want to get in your type 1 diabetic son. But keeping carbs low is in his best interest. The reason that if kids or anybody type 1 are on a low carb diet, they are dosing themselves their insulin according to that diet, okay? When blood sugars spike, it's because most type 1 diabetics chase their blood sugars because of glucagon. In a non-type 1 diabetic, in the pancreas, there's alpha cells and beta cells. Beta cells produce insulin and alpha cells produce glucagon. These cells sit very close proximity to each other and they talk to each other, okay? So the glucagon cells, alpha cells are talking to the beta insulin cells. When the insulin is being secreted, the alpha cells don't secrete glucagon. They talk to each other. They're in very close proximity, okay? Now, in a type 1 diabetic, there is no beta cells producing insulin. So there's nothing to talk to the alpha cells to shut down glucagon that will raise blood sugar, okay? The eventual outcome is higher blood sugar. Because even if you gave extreme amounts of injectable insulin, it's not, that concentration could never reach high enough to be able to talk to the alpha cell to shut it down. So most type 1 diabetics, because they don't have the talking between the alpha and the beta cells, and the concentration of insulin is not high enough to talk to the alpha cells, those alpha cells are producing glucagon all the time. So type 1 diabetics tend to chase blood sugars, not because if they're on a low carb diet, not because of what they're eating, but because of the glucagon secretion, causing increased blood sugar. Again, if you'd like to sign up for a consultation, email me at ironladydoc@aol.com. Okay. Cora asks, what do you know about POTS? My blood pressure when I wake up is average of 87/57. When I get up to go to the bathroom or get something to drink, it goes up to 130/62. So that's quite a bit of I don't know how old you are. Do I have any patients with POTS? I have 2 patients with POTS. It's not a very common diagnosis, but I want you to notice something about your blood pressure. 87/57. That is a 30 pulse pressure. So you take 87 minus 57. You got a gap of 30, okay? Say like a normal blood pressure is 120/80. 120/80. That's a gap of 40. 120 minus 80 is a gap of 40. So that's called a pulse pressure of 40. Your 87/57 is 30. Not bad, right? But when you get up or get something to drink, you are going 130/62. Look at your pulse pressure. That tells me when that pulse pressure is that high, it tells me that your arteries are stiff, like lead pipes. You could be low on nitric oxide. Again, as we age, our arteries can lose collagen and elastin. That increases our risk for injury. That increases our risk for blood clots. That's a huge pulse pressure. It's taking a lot for that blood to get back up to the heart. It's a huge pulse pressure. And I guess I would look into other things, other comorbidities, I should say. Brendan, welcome. Thanks for being here. JTS says, I didn't want to take statins, so my MD recommended red yeast rice, and my LDL decreased 25% in 6 months. Well, you didn't want to take a statin, but you decided to take a statin, JTS. Red yeast rice is a statin. Okay? It's lovastatin. It's Mevacor. So you're basically taking a statin. You're blocking the mevalonate pathway with red yeast rice. Hopefully you're taking some CoQ10 and vitamin D and vitamin K and all of the things to protect your body from, but you're still decreasing your production of hormones. Hopefully I answered your question. Is red yeast rice safe? If you want to take a statin, then I guess I would consider it safe. Okay. Igloo says, for the past few days, whenever I take a deep breath and expand my chest on the left side of my chest feels like cramping pain, and it stops when I exhale instantly. Igloo, I would see your doctor, get a chest x-ray and maybe even an echocardiogram. But best case scenario, you have intercostal myositis. So you have inflammation of the muscle between your ribs. Worst case scenario, you have pleurisy and or heart disease. I would have it checked out. Igloo, see your doctor. Okay. Jim, do you have a question? Let me know. Chorus says, I'm 71. I think I'll make an appointment for a consultation soon. I have several comorbid conditions. All right, Cora, we'll look forward to that, okay? Hopefully help you walk through some of those things. Likely they're all interconnected, connecting the dots. Yeah, you're very welcome, Tracy. Glad to help. Make sure I did not miss anything. Any other questions, you guys? This is your opportunity to ask medical questions. Put a question mark in front of it so I can see. Let's see, Susan. 74 male. No. Falls over into canal. Report us. He drowned. Could heart attack prevent you from swimming on your... Whoa, Susan, help me out. I can't... I don't understand what your question is. Sorry. All right, you guys. I mean, if you don't have any questions, today's Sunday. We can call it quits. I have no problem. I've got some stuff to do, but Igloo says a person having a heart attack won't be able to swim. Yeah, most likely they can't do a whole bunch of other stuff. Heart of Adiger. I have a number of illnesses, but over the last few weeks, I've got severe low back pain. It's almost impossible for me to walk. I'm 62 with various autoimmune diseases. Sounds like you got a lot of conditions going on. Are you seeing your doctor? Have you had an x-ray? What does your inflammatory markers look like? Your HSCRP, your interleukin-6, your TNF-alpha, your SED rate. I'm guessing you're just making a comment. I'm not sure. I don't know how to answer that. Donald says, you've covered these before, but what's your opinion on glutathione and NAD? I think our body makes them on their own, okay? They make them on their own. If we allow it to. We have to have the right nutrients in order for that to happen. Where I've seen decrease in glutathione is people who have a lot of oxidation going on, a lot of reactive oxygen species are being produced. And we use up all of our antioxidants. But that doesn't mean that we just go take antioxidants like vitamin C and glutathione and NAD and NO and all of these, supplements. We have to figure out what is decreasing them or what is using them all up. Is it our diet? Is it our lifestyle? Is it our lack of sleep? Is it the blue lights we're under? Is it 5G? What is the cause? We have to look into it instead of just taking all these supplements, okay? Again, Igloo, even if it happens randomly and you have left-sided chest pain, it needs to be looked into. Kimberly, I'm sorry if I messed that up. Floating bowel movements for 6 months. Could this be a lack of fiber? Or it could be fat. Fat floats. Srinath, do you trust in CPR or a defibrillator being more effective? Well, I think while you're finding the defibrillator and hooking it up, you should be doing CPR. It's not like one is more effective, it's whatever you have available. If all you have available is CPR, do CPR. If there is a defibrillator present, you do CPR until somebody hooks it up, puts the patches on, and can use the defibrillator. But you need to be trained in both of these things, okay? If there's a weak, workplace health safety training, if you're gonna, yes, you would want to defibrillate that person, especially if they're in VTAC, and you shock them, you hopefully shock them out of VTAC. When we had defibrillators in my training, but we learned about the precordial thump, where you would actually take your fist and you would thump the patient with your fist in hopes that that precordial thump would knock them out of their arrhythmia. And we are trained on that. If you come upon somebody and you suspect that they're in VTAC, which is very common, or VFib, and you do a precordial thump, it's kind of like putting shockers on them and defibrillating them. But if I had a choice, I would rather you defibrillate me than continue CPR, okay? That would be my choice. Henry says, if someone is on the lower end of the reference range for free T4 and free T3, would that exclude reverse T3 as an issue? No, it would not. T4 is inactive. It's not very accurate, okay? Even if it's on the lower end, I would get antibodies, TG and a TPO, but I would also get a reverse T3. It still could be blocking the T3 receptors. Stress, hypersympathetic overdrive plays a huge role. What about your liver health? Okay. In the liver is the place where T4 is converting to T3. And if your T4 is low and your free T3 is low, then I would lean more toward reverse T3 and I would get that level. But I would want to know antibodies. Also, I don't know what the diet is. I mean, T3 will naturally be lower in carnivores, but yet the TSH will be fine and the person feels fine. You don't mess with it. If it's just somebody who's eating just a standard diet, a T3 around 3 to 3.5 is where you would want it to be. Okay, that means that the T4 is converting nicely to free T3, which we need. Okay, you want the active form. Damia. My husband just turned 40 and had high cholesterol since he was 15. I don't know what you consider high cholesterol. Was it high cholesterol on a lipid panel? Was it was it high LDL, high HDL, high triglycerides? What is high cholesterol? We eat healthy. What's the definition of eat healthy? No Cetos, great. Nothing processed, great. But you could not eat seed oils and not eat anything processed and yet still not eat healthy. So I don't know what eating healthy is, and I don't know what his lipid numbers are. Even if his mother had a heart attack at 40, again, I don't have enough information to be able to give you any sort of coaching on that. Tracy says, is my son at risk of a heart attack, stroke in the very short term? This is what his endo said because of LDL, why she keeps pushing statins on us, and I asked to get to the root cause. Okay, in her opinion, Tracy, I'm guessing, I don't know her brain and how it works. I can only speculate that those doctors who are on the bandwagon of LDL is bad will say that the sheer volume of LDLs in his blood botches things up and can have ramifications for a heart attack. Now, if you are on the side of a thrombogenic cause of heart disease and stroke, you must have an injury in the lining of the arteries from sugar, from insulin, from smoking, from drinking alcohol, from heavy metals, from nanoplastics, from things like that that can cause an injury. Seed oils can cause an injury. Iron I had mentioned heavy metals. So all of those things can cause an injury to the lining of the artery. Stress, high sympathetic tone, anger, irritability, things like that. You get an injury to the lining. A scab or a blood clot forms. And hopefully that blood clot is dissolved over time. It's a healing process. LDL is also in that healing process. So is LP little a. They want to heal the injury. But if he has high LP little a, which increases blood clots, and he's got factor 5 or factor 8 or prothrombin mutation, then he has increased risk of blood clots. If he's an angry kid, he's got increased risk of blood clots. Blood clots cause heart attacks and strokes. The sheer volume of LDL becomes a problem if there's VLDLs in the system. So if the liver's pumping out a bunch of VLDLs because of what he's eating, and the LDLs are staying in the bloodstream, like they are, you measured them, they're 500, that VLDLs and the LDLs collide together. When they collide, there's a reaction that takes place with something called CETP. I call it CETP. CETP causes an exchange of cargo. The VLDL will dump its cargo into the LDL, and the LDL will give the VLDL some of its cholesterol. This reaction is not good because it strips the LDL of all of its components and gives it triglycerides. And LDL is not meant to carry triglycerides. It makes it very susceptible to oxidation. So these LDLs can now become small dense LDLs. And small dense LDLs can be damaged via oxidation. And then those small dense LDLs and oxidized LDLs are sticky, and they can stick to the injury of the lining. So I believe it is a combination of thrombogenic hypothesis and lipid hypothesis working together. If it's simply, Tracy, his diet, and there's a lot of animal fat, saturated fat, just lower the saturated fat and increase monounsaturated fat. His body might not be good at taking in all of that saturated fat. Some people cannot tolerate it. Others can eat sticks of butter and their LDL stays around 130, 140. And others, like your son, it's 500. The liver doesn't do well with that much saturated fat. And it might not be from animals. I mean, coconut oil, MCT oil, is very high in saturated fat, and that comes from a plant. In fact, there's more saturated fat in coconut oil than there is in a ribeye steak. So if you lower some saturated fat and increase monounsaturated fat, like maybe some avocado and maybe some macadamia nut, or maybe emu oil, or duck fat, things like that, lard even, will increase or help lower LDL. I don't think that we should go to a complete monounsaturated fatty acid diet, because monounsaturated fat has at least one double bond where oxidation can occur. Polyunsaturated fats have many double bonds where oxidation can occur. Saturated fat, no double bonds where oxidation. So saturated fat is the cleanest, safest fat, but yet our body may not be able to handle it. So instead of 70-30 ground beef or 80-20 ground beef or even 85 ground beef, get 97-3. Get a sirloin instead of a ribeye or a New York strip, or get a filet. Lowering the saturated fat would help. Change butter to emu or lard or duck fat. But I would definitely get a cholesterol balance test, and I would get an FH panel, familial hyperlipidemia panel. It'll test for PCSK9, LDLR, which is the LDL receptor, and the ApoB1. These are genetic defects that he could have been born with. But the cholesterol balance test will determine whether or not he has NPC1L1. I would like to look at his liver function, his thyroid function. He could be an 11-year-old type 1 diabetic with hypothyroidism, and that's what's increasing his LDL. I mean, seriously, that endo, I'm hoping that he or she looked into all of this, but who knows? Maybe their answer for everything is a statin. It's the vitamin of the years. Damia says both maternal grandparents had triple bypass. I did get him Both maternal grandparents. Okay, so mom's grandparents. Again, genetics is important, but not as much as how you feed your genetics. Epigenetics is more important. You're getting him a CT angiogram and waiting on the results. He feels great. CRP is 1.7, that's high. A1C 5.5. What is his insulin? What does his liver function look like? What does his thyroid function look like? Lots going on. Yeah, KB, those are things that I would have to probably look into much deeper. I wouldn't be able to answer those questions in regards to chelation. Okay, so Damia, your husband has a triglyceride of 214. I'm guessing that your husband has diabetes, okay? Homocysteine of 10 is fine. I like it less. I like it at 8. Yeah. Yeah, his LP little a is 169. Again, those are there. You're giving us a lot of risk factors, but the biggest one is likely he has a high insulin. He's got high belly fat, which is liver fat, and that big kind of a beer belly type look. That is where the danger is, and that is high risk for heart attack. The answer is not taking a statin. The answer is reversing the things that are causing that, which is usually diet. Yeah, KB, everybody, all the doctors are going to jump to pills. That's the easiest thing for them to do. Why would they do anything else? It makes their job easier. When they make a diagnosis, all they got to do is write a prescription. That's easy. That's easy peasy. Tracy says, yes, he was a huge Coco June. I don't know what that is. Full fat coconut, yogurt, bacon, butter, eggs. We have made changes in the last couple of weeks. It's not that you need to take away the bacon, butter, and eggs. It's just that you just lower it a bit. Get rid of the coconut, whatever, because that's very high in saturated fat. And exchange the butter for lard. Exchange the butter for emu oil. Or it comes in a tub as well. Or duck fat. Duck fat is higher in monounsaturated. It's lower in saturated fat. I'm not opposed to the eggs and bacon. Don't hear me say that. It's just that some of the other things we could lower, right? Maybe you do eggs and lean ground beef instead of eggs and bacon. And in all reality, we don't even know what his diagnosis is. We don't know what his diagnosis is. Find the diagnosis. We're talking about diet, and we don't even really know the diagnosis. Maybe he can eat all those things, and he's got another problem. Damia, the glucose is always 90. That's too high. 70 to 80 is normal fasting blood sugar. What is his insulin level? It must be high because his triglycerides are high. His VLDL is high. Igloo, I need to do an x-ray to find any damage to problem to the heart. I'm not sure what your question is, but you maybe are talking about a CT, a calcium scoring test, a CAC score, or a CT angiogram, but not an x-ray. It's not going to show much. Although we have picked up aortic sclerosis on a chest x-ray before, and calcifications in breast on a chest x-ray. So you can pick up some incidental findings on chest x-rays. What is my email to reach out for a consult? ironladydoc@aol.com. 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 Madhav says, hello, how to work on insulin resistant? Lower your carbs. How to make muscle faster? Lift weights. Eat protein. Julie says, I'm a physical therapist. I have a new patient who's on amiodarone. She has tremors as a side effect of the amiodarone. Gait is unsteady. Has AFib, and an ablation did not help her. Any options for her? Resting heart rate 105. Did you say how old she is? 90 years old. How is your 90-year-old feeling? You know, again, that is a deep history, and likely she's had these things over time. As we age, we get bundle branch blocks. Our pacemaker cells in our right atrium in the SA node gets stretched. It's a normal aging process, especially for somebody maybe who didn't really exercise, didn't really do much on diet. But you have to ask yourself, and is the side effects worse than maybe getting her off of the amiodarone and changing her to something else? She might not tolerate a beta blocker. I don't know. I don't know her history, but it would be worth her or somebody. See, you can't expect a 90-year-old to go to the doctor on their own and be their own advocate, because the doctor pretty much just walks all over them and says, here's what you need, and then she probably won't tell them that I'm kind of dizzy, my gait's unstable, and I'm having to go to physical therapy to work on my gait, when it's all because of the medicine, for instance, or something else. Okay, no one's looking into it. Thank you for looking into it and not letting your 90-year-old, just fall over. But I mean, could it be the amiodarone? Could there be an inner crystal in their inner ear a problem? I mean, I don't know if you do that or test for that, but that could be an option, an answer to her unstableness. JTS says, my oldest son is an oncologist, phlebotomist. So your oncologist draws blood, and his daughter is now in med school. I'm so encouraged by bright, well-educated women and consider you an inspiration. Thank you, JTS. That means a lot. I appreciate those kind words. So, Madhav, you are, how to work on insulin resistance. I have belly fat, but I don't have fat in arms and legs. I'm going to go out on a limb here, and I'm going to ask you, you may or may not want to answer me, but Madhav, are you of Southeast Asian descent? Are you Asian? And the reason I ask is all of us have what we call a fat threshold, We have a certain amount of fat cells on our body that have a threshold on how big they can get. And some cultures have a very low threshold. They can only get so fat. And that could explain why somebody is thin on the outside and fat on the inside. The fat on the inside is called ectopic fat. You'll see some people who can get so fat, they're morbidly obese. And you say, how much fatter can they get? And the answer lies in the fact that some people are able to make more fat cells, and those fat cells can get bigger. Now, it's not everybody, but their fat threshold is increased because they have fat cell hyperplasia and fat cell hypertrophy. In certain cultures, they don't have that. They only have a certain amount of fat cells. They reach their threshold of size, and then everything else starts building up inside. These people have high risk of diabetes before the really obese, morbidly obese person. Imagine that. So a little skinny person who looks really skinny, no fat on the arms and the legs, you could look lean, okay? That is not a very good sign, especially in an Asian. They will have well, I've seen it in white people too, but they'll have very, like their calves will be huge. okay? They'll have these, what look like muscular legs, but they're not. They're very weak. And that is an illusion of the fat deposition. So these people have very high amounts of fat inside their abdomen, fatty liver, fatty pancreas, fatty kidneys, fatty heart, fatty organ disease. Very, very high risk for heart attacks. They're very high risk for diabetes. If they have insulin resistance, that is underlying diabetes. They have diabetes already. The only thing that these people can do is lower or restrict carbohydrates. Get rid of them. Reverse and get that insulin level down. Fasting, no carbs. Those are the things that will lower your insulin level. Okay? Sleeping lowers insulin level. Okay? But yeah, belly fat is very high risk for blood clots because visceral fat releases PAI1, plasminogen activator inhibitor 1. So it's going to increase our risk of developing blood clots. Simply having liver fat or fatty organ disease increases our risk of having blood clots. Then if your LP little a is high, it's maybe over 35, that's another risk factor. What if you have factor 5 and factor 8 or prothrombin mutation? Those are other risk factors for blood clots. You need to get a clotting panel. Lots to look at if you want to know, what are my risk factors? What are my risk factors? If it doesn't really matter to you, don't check. Don't check. But you're asking me, how do you work on insulin resistance? Insulin resistance is high insulinemia, high insulin in your blood. The only way you can lower insulin is to lower blood sugar. And one huge way to lower blood sugar is to get rid of carbohydrates. Okay. Handsome, huge tiger. I think I just answered your question on how to remove your big belly. John says, my triglycerides were 225 and got it down to 145 and no diabetes. 145 is still too high. But congratulations, John. That's awesome. Julie, I am live on Instagram and YouTube, so I am reading questions from both sides. But thanks for asking. Cheesehead, I'm always hungry. How do I turn off my hunger? You're on a crapola diet. Cheesehead, change your crapola diet to a ketogenic diet, ketovore, carnivore diet, and you'll turn off your hunger. Protein and fat. I don't know what your question is there, so we'll skip it. All right, I think we are done with a few of you, so let me work on that, you YouTubers over here. There we go. We don't want any cussing going on. Okay. Doing some cleanup over on YouTube. I apologize, Instagrammers. What do you think about orthomolecular program with fenbendazole and the neutral? Let me see who that was. Original K, thank you so much. That made my day. This has been a difficult one without Lucy here, and I really appreciate that. That makes me smile inside and out. Thank you so much. Mad Have, if you lose weight, can your skin glow? It's possible. Your skin is dull because it's lacking of collagen and elastin and health. And you have a dark neck. That's called acanthosis nigricans. That is insulin resistance. You have diabetes. Yeah, Cheese, you're a male, 248, high blood pressure, even on a pill. That's a danger. I mean, it's up to you. You either change or you don't change. But back to Ruby, what do you think about the orthomolecular program? I don't know anything about it. It's with fenbendazole and the nutritional program to cure cancer from Dr. Bogley. I'm not familiar with it, but I am sure that the studies are ongoing and there's some positive aspects. Psalm 91 says, is bread bad? Yes. What type of bread do you recommend? None. How many slices per day? 0. Are legumes on a daily basis good? No. What foods give the highest protein? Animals. Beef. Deer. Ruminant meats are the best. So sheep, bison, buffalo, deer, cow, those are the best. Okay. John says, when my triglycerides were 225, my glucose was 82. Yeah, you had a ton of insulin on board to get your glucose to 82. So high triglycerides means high VLDL. Hi, Shelley. Miss Tori says, any advice for lactose intolerant? So don't drink milk. Don't eat dairy. Don't eat lactose. Madhav, I don't have any reviews on Ozempic. It's a GLP-1. If you had a particular question, I would be happy to answer it. Madhav, oh, you're from India. So you're of Indian descent, which again, that is a problem. So your fat threshold has now put you into a category where you're very, very high risk for coronary artery disease and stroke. Matt, I can't really answer that. You know, what you should be eating after the age of 50. I don't know what your health history is, but I would avoid a standard American diet. How about that? Avoid all sugar, seed oil, and processed foods. No processed foods, seed oils, or sugar. Okay. Half Hawk says, do you agree that slow, controlled breathing can calm the nervous system, reduce stress and anxiety, improve focus, and create space between emotions and reactions? Absolutely. Absolutely. Box breathing, increasing parasympathetic tone. So parasympathetic tone exercises, vagal tone exercises to help diminish sympathetic nervous system. In modern society, we are in chronic hypersympathetic overdrive. We are in sympathetic overdrive. We are, the balance between our sympathetic nervous system and our parasympathetic nervous system is so off balance that I think it's one of the causes of heart disease, of blood clots, is because of high sympathetic overdrive. And it has nothing to do with LDL. Okay, you could have low LDL and have a heart attack simply because you're a stressed out person who hasn't learned to control their sympathetic nervous system. They're in chronic fight or flight. That's supposed to go away. When you run from a lion because it's going to eat you, but when the lion is gone and you're hiding safe, the sympathetic nervous system is supposed to come down and your parasympathetic, calm and relax, is supposed to go up. We are not doing that. And we are increasing our risk of heart disease. Oh, thanks, Cheese. I want to be an inspiration to you, but it is difficult. You know, I can easily say, Cheese, just stop your diet. Just stop doing it. And you say, Dr. Jensen, that's just so easy for you because you don't eat crap. And I say, I know, I get it. But if it meant that, at one point, I was eating a crapola diet, and now I'm not. So it is possible. You just have to want it. And I can't want it enough for you. You have to want it for you. If I was on the verge of diabetes, I would make drastic changes. There's absolutely no way in my mind. I would have not let myself get there in the first place. That's the whole thing. I don't want diabetes. I don't want a heart attack. I don't want a stroke. Food does not mean that much to me. That's a waste. Okay, and it's hard to explain. But you have to make changes, but it has to be for you. Okay. I started gym and weight loss. Can it help? My current weight is 98 kilos and height is 5'11" at age 23. Yeah, Matt, you're in a world of hurt, but congratulations. Starting the gym is awesome. That's 25% of the battle. 75% is what you put in your mouth, your diet. All right, Matt, I'm glad that you don't have a pumpkin head. And yeah, if I could be 23 again, I think if we all were 23 again. Yep, Henry is telling Matt, go low carb, drop the carbs, including rice. Drop everything, drop all carbs, right? No fruit for sure. Absolutely no fruit. That is causing liver fat just looking at it. I'm kidding, but you know what I mean. She says, I just can't see me eating a hunk of butter. Then don't. Think about eating steak and eggs and ground beef and turkey and chicken and fish. Think about those things. Think less about everything else. Half Hawk, I don't know the answer to that. You had an upper thoracic sympathectomy to abate hyperhidrosis. Are there long-term? I don't know about the side effects. I would have to look into it. Snowco, I would probably see your doctor about your binge drinking. Yeah, Matt. His name is Buddy. His name is Buddy Blue. He was a rescue from Rescue Rehab and Rehome. And I have a live fundraiser on Instagram right now. But if you guys would like to donate to Rescue Rehab and Rehome, it's a local rescue right outside of Metro Des Moines, Iowa. Rescue Rehab and Rehome. And it's important to me. I have 2 dogs from there, Tallow and now Buddy. And Buddy I adopted him or rescued him a week before my birthday, for my birthday. And I was notified by the rescue that he was available and asked if I would take him. He came from Oklahoma, I believe Norman, Oklahoma, where Norman Tallow came from. And I'm a big believer in rescuing dogs and supporting rescues that save dogs and get them off of death row. They usually, in these states, they have a 30-day kill policy where if the dog has not been adopted, they will euthanize them at 30 days. And I don't like to see that, okay? I also don't like to see people supporting a bunch of breeders. But again, I can't stop you from buying a dog wherever you buy the dog at, okay? That's not my point. My point is I hope that you would help these little rescues save these dogs, okay? All right, so Lucky Life. Hi, Doc. How are you? I'm great. Happy Sunday. I just joined the chat. I have a question regarding COVID-19 vaccine. I had a blood test and my spike was 21,000, so 21.7,000. So I just started a spike detox pills. What do you recommend? I don't know enough about it. Are you getting it from the wellness group or where are you getting it? I mean, there's doctors all over. I know some of my listeners are in Arizona and Scottsdale area and they see specialists in regards to long COVID. There's some in New York. They're scattered. These doctors are scattered all over. I don't know much about testing, although one of my friends who is down in Arizona has long COVID and is going through some lab testing now that is, it's wow, it's deep, okay? And I'm looking forward to following along with him because it's been, 6 years now. And he was a crazy athlete. He went from lifting weights and doing a lot of resistance training to being basically a professional cyclist. And he was amazingly fast and amazingly strong. And then the spike proteins, if that's what they are, has really put a damper on his life. And I feel for him, but he's not going to quit. He's not going to quit, and he's going to, he's going to keep, and he's going to try to figure it out. And hopefully he finds a protocol that works for him. Yeah, thanks, Cheesehead. Bless your heart for doing that for Buddy Blue. It was, he's an amazing little dog. I don't know his history, although I don't want to move him right now, but he's got a huge scar on his chest. It's got to be at least 6 inches. And he does have a heart murmur. I don't know if he was injured. It doesn't look like, a straight heart, a scar from a heart surgery. It looks like maybe an injury. Okay. What suggestions for Hashimoto's? I would change my diet. If I had antibodies, then it tells me that I have inflammation going on in my body, and I would go on an anti-inflammatory diet, which for a while might look like meat, salt, and water. The antibodies will not come down for at least a year, so don't keep checking. Go by how you feel. Matt says Oklahoma, where the wind comes sweeping down the plain. It's one of the places where I'd like to go sometime in early June or late May to watch the college softball World Series. I would love to go to Oklahoma City and watch that. It's on my, what I would call a bucket list. Henry says ivermectin and nattokinase for long COVID. That's a good suggestion. How to lower your triglycerides, lower your carbohydrates. Lower your carbohydrates. Cheesehead, how often can you check your blood work safely? I mean, depends on if you want insurance to pay for it. Usually my patients were getting it every 3 to 4 months. I usually went 4 months, so 3 times a year I would check their blood work. Domia says, do you think women should be fasting? I heard it can mess with your hormones. What would it be messing up? Here's what I think about fasting in women. If you are very low body weight and low muscle weight, I don't think you should be fasting, okay? It can decrease muscle mass. It decreases bone mass. I understand that you might want to do it on occasion to encourage autophagy. But again, you have to ask yourself, why would you fast in the first place? Do you have a problem with weight? Is that why you're fasting? What is the reason for fasting? Let's see. Hello, doctor. Back to nature from Port Harcourt, Nigeria. I love this medical education. God bless you richly, and God bless you as well. Thank you. Psalm 91 asks, what does a healthy diet look like? Well, a healthy diet to me looks like a ketogenic diet. An unhealthy diet looks like a processed food, seed oil, and sugar diet. Steph says, is allulose an acceptable sugar substitute? According to me, oh my gosh, Lucy, I am so happy to see you. Lucy is my Blue Shield, my moderator over on YouTube. And it's been a bit of a disaster for everybody listening who actually had medical questions. But we've been hanging in there, but thank you for being here. Is allulose an acceptable sugar substitute? Well, why do you need a sugar substitute? Why do you need sugar? I wouldn't, personally, I don't use any substitutes. None. I don't need the sugar. I don't need the sweet. Why do you need the sweet? I know I'm a tough one, aren't I? Okay, lucky you're using the wellness group. I've heard about their program, but again, I haven't looked into it, so I apologize. Avo, hopefully I didn't mess that up. Let's just call you Avo, longtime endurance athlete, 59 years old, calcium score of 664. Statins almost killed me. LDL is under 100 without them. ApoB, LP little a, blood pressure in the 130s with amlodipine, so olmesartan, amlodipine combination. Yeah, cardiologist wants you to be on what, statins or something. Why do you have AVO? We've talked about the athlete's paradox before on my channel, and it sounds like that you do have the athlete's paradox. Athletes who are endurance athletes, they run, they cycle. Because of the sheer amount of volume of blood and the pressure of blood that's being shot through the heart, it causes irritation in the lining of the artery. It damages the glycocalyx, and it can also damage the endothelial cells, and then scarring occurs. So you get blood clots and that calcifies, and you get blood clots and it calcifies. And so you have the athlete's paradox where you might have blocked arteries at 664. We don't know. You could do an angiogram. You could do a CT angiogram and check how much flow is going on in your arteries. But I would speculate with high confidence that being a long-term endurance athlete, you have collateral blood flow and not one part of your heart. Even if you have a completely blocked artery, you have no death of your muscles in your heart, because you have developed collateral arteries that have fed your heart with blood, despite the fact that you have blocked arteries. And are they really blocked? On a calcium score, the imaging can pick up calcium by the reflection of the light, and it's not really blocked at all. The lumen is open. Again, you don't have an LDL problem. You have an exercise problem. You have caused your coronary artery disease by your endurance activities for years. You can either stop or you can continue, but you are not going to die of a heart attack from clogged arteries. Your heart is going to give out because of the electrical system. You are damaging your own electrical system in your heart. It's called sick sinus syndrome. Okay? People think that they're endurance athletes and their low heart rate is a good thing. It is not. You are most likely, these endurance athletes are losing their SA node, their pacemaker cells, because of the right atrium is stretching out to levels that it cannot tolerate. It damaged the SA node, and then you lose your pacemaker cells. And eventually, individuals like Avo end up needing a pacemaker and a defibrillator. They don't have heart attacks from plugged up vessels. They have heart attacks from going into VFib or VTAC. I had one listener who says he carries a defibrillator along with him on his long rides. If you know that your rides are causing a possible problem, wouldn't you just stop that and do something else? But seeing a sports cardiologist, Avo, would be in your best interest instead of just a general cardiologist who says, ooh, calcium score 664, here's your statins. Why? The fact that you have muscle aches tells me that you're depleted in CoQ10. You're already depleted in CoQ10. You're already having some problems with your liver, whether you know it or not. You are likely indulging in carbohydrates in order to supply your energy for your long runs instead of being ketogenic and working on ketones. So you're actually causing your own diabetes and your coronary artery disease. At the same time, you are causing bundle branch blocks, stretching of your right atrium, destruction of your SA node over time. Is it everybody? No, not everybody who does endurance sports, but I will tell you, it is a majority. Ask all these endurance athletes if they have a pacemaker, and you'll know the answer. Okay. Cheesehead says, a topic idea. Can you talk about gym process if we are gym rats? I have a PF which is closest. Talk about it like back to basic if I go just walk on a treadmill. So you're asking if one of my topics would be getting started on an exercise routine? Is that what you're suggesting? Pancho, if you would like your question answered ahead of time, there is something called a super chat where you can donate some funds, some money, and you will get your question answered right away. When people make a comment, I like to, if it's of interest to me, I like to comment back. If you have a deep burning question that you would like me to look at, I would be happy to do that. But if you want it answered right now instead of being rude, then you could just do a super chat and support the channel, and that helps me. Thank you. Yeah, Henry says, yep, former endurance cyclist, CAC score of 428. Give up the endurance exercises, Avo, is what Henry is recommending to you. Nello says, Dr. Brian Artis recommends nicotine patch for long COVID. It's helped some friends of mine. He has a good book out. KB says, my friend going through chelation therapy has the spike protein. We were nurses giving out COVID vaccines at work. She got 2 vaccines and COVID twice, ended up with vasculitis, ANCA. That's too bad. That is a very, very sad story. And I'm sorry to hear that, KB. That is, she's not the only one. Was a Big Garlic says, how do you slow down or even stop liver fibrosis? Get rid of fruits, alcohol, and carbohydrates. And hopefully the liver is very good at regenerating. Give it some time. Get rid of fruit, carbs, and alcohol. 0. What do I think of plain fat, non-fat Greek yogurt? It's fine if you want to eat dairy. What is the best organic oil to use when cooking? I only use very limited. I would do emu oil. I would do lard, actually. I would do lard. I don't use any oils. Domia says, I got an 8-year-old daughter with a TPO antibody, so a thyroid antibody of 450. Meats, a little rice is her diet, gluten-free, mostly dairy-free, on occasion, no oats, TSH, T4, T3, all normal. Well, they might not be. I don't know what your definition of normal is. Did she get Hashimoto's from me? It's a possibility, but something fed it, that's for sure, right? I missed some things in here. Avo says, I think you were right on. Thank you so much. You're welcome. And I have experience with this, Avo, because my dad, who has passed away, was a runner for 50 years. And they found out he had an attack while he was in the locker room after a run. And he went into either VTAC or VFib, I'm not sure. And a gentleman who was in the locker room saved my dad. And they brought him from his small town, Iowa, to Des Moines area. And one of the cardiologists did an angiogram. My dad had humongous amounts of collateral blood flow to the heart, no death of the heart, okay? And they bypassed all 5 vessels of my dad, despite the fact that he didn't have any part of his heart that was dead. He had all of this collateral flow. They still bypassed my dad. Is that the right thing? Maybe back in the early 90s, it was. Do I think it is now? No, I think it's an invasive procedure that needs to be individualized. Because they went to angiogram, found the blocked vessels, they had no other option but to do a bypass on my dad. They also put a defibrillator and a pacemaker in my dad because his heart rate was down in the 40s all the time. The problem with my dad was what I tried to explain to you. It's the electrical problem. He did not have a plumbing problem. He had an electrical problem from what he thought was good for him. And then they found out he had high cholesterol. Guess what they put him on? You guessed it, a statin. Guess what they told him not to eat? You guessed it, meat. So my dad ate boiled chicken and bran flakes and sugar-free ice cream and vegetables and rice and beans, all of the things that likely increased his insulin and increased his inflammation. And then my dad ended up getting a type of Parkinson's disease. Do I think that the statin had something to do with that? I do. When you're on that for 40 years. Yeah, there's a lot of things that I have questions about, and I have ills that it bothers me, okay? It bothers me that the things that standard of care pushes on people without even looking. And I didn't know back then what I know now, but I would sure stand up for my dad right now. I do anyway, but if we could go back in time, there would be some changes, okay? And I would have told my dad to stop doing whatever he was doing, but I did not know. I did not know. I did get him to start lifting weights, and that naturally decreased the amount of running he was doing, okay? But yeah, that hits home on a personal level, Avo. And it's hard for me to see these athletes doing this to their body, and they don't know what they're doing to their heart, because on one side of the story, they're being congratulated. Oh my gosh, you're in such great shape. Your heart rate's so low. You probably are so healthy. You look so lean. You do. Yep. And you are death. Yeah, from the outside, you look like a perfect specimen, and on the inside, you're death. Like bodybuilders, okay? They're walking time bombs. So it does hit me personally, and I guess I'm looking out for you. Yeah, Avo says his resting heart rate is 38. Your pacemaker cells are not working anymore. And if that is during the day, your resting heart rate, what is it when you go to sleep? Is it hitting 30? That is a danger, Avo. That is not good for you, okay? That is a danger of going into an arrhythmia and dying, okay? So you need to go to a sports cardiologist and get a flow MRI and check for fibrosis. The thing that I know that my dad had, and I'm suspecting that you do too, is because the stretching of the atrium, the right atrium, is so much, the heart is hardening. You get cardiofibrosis, heart fibrosis, hardening of the heart, scarring of the heart. Your heart is not flexible anymore. It's dying. It's dying. And that's scary proposition, knowing that you feel great right now. That the minute, you know what's funny? And my dad, did he go back to running after that episode? Not so much. It limited him. He really got into lifting weights. But it took that episode, the bypass surgery, the defibrillator, the pacemaker, to get him to stop doing what he was doing. It didn't change his diet. He did exactly what they said. No saturated fat or cholesterol. He didn't even eat eggs anymore. He was eating egg whites. The cognitive dissonance. You know what? Everybody was bamboozled by the buffoonery. That's what it was. Buffoonery. Cognitive dissonance. What do I think of extra virgin olive oils? I think that they're laced with seed oils. I think they're not real. That's what I think. I would never use extra virgin olive oil unless I saw him crush the olive and put it in a jar, and then I traveled home. I took care of one for you. Madcap says, fastest way is to lower carbs, right? Yes. Can I do intermittent fasting? I don't know what medications you are on. I don't know, should you just go into a low carb diet? Again, I can't recommend that because I don't know what medicines you are. Are you on blood sugar lowering medicines? Are you on blood pressure medicines? If you go into a ketogenic diet from a standard American diet or standard whatever diet, and your insulin levels drop, your blood sugar is going to drop, you're at risk if you're on medications. It needs to be managed by your doctor. I don't know what an Indian diet is, Madhav. I'm sorry. Was a big garlic says, thanks, doctor, for answering my question. Do you think ivermectin can potentially kill hepatitis virus? Possibly. But what do viruses eat? What do viruses eat? They eat sugar. They eat iron. What is your iron levels? What, have you ever had an iron panel? An iron, a TIBC, a transferrin, a ferritin, a saturation level? Have you ever looked into that? What do viruses eat? Can you potentially starve your virus? Good question, right? Okay. Yeah, okay. Not on any medicines. That's a good thing, Matt have. Peaceful fun. What about a plant-based whole food diet? Does that mean that you're going to use supplements as well on your plant-based diet? I would hope that you're going to also use supplements, because a plant-based diet is deficient in nutrients. Yep, so you are going to. That's fine. If you choose to, you want to do a plant-based whole food diet and you're going to use a whole bunch of supplements because you don't have carnitine, carnosine, creatine, all of those, you don't have your B vitamins, yeah, go ahead and take your supplements and do the whole plant-based food diet. That would be okay. No, you do not need a multivitamin, Matt have. You don't need any multivitamins. You should not need any vitamins at all. Unless, of course, you're going to be on a whole foods plant-based diet. We don't have any cussing going on this channel, so we'll put that one to bed. Okay. Avo, 38 is sleeping. You are resonating with me. It's hard to give up, but lifting weights and yoga and not so much running, or none at all, because you've already got a problem, right? And triathlon any longer. I hear you loud and clear, doctor. Thank you. You're very welcome. How can an iron panel help? Because I want to know what your iron levels look like. I want to know if you have iron trapping in organs. What are the viruses eating? What are the viruses eating? What are the pathogens eating? What does TB eat? Tuberculosis. What does cancer eat? What do they eat? Stop feeding them. If I want to know what is going on with your heavy metal stores, your iron stores, iron is a huge food. It's like a buffet for viruses and bacteria and fungi. It's a buffet. They love it. They love sugar. Okay? Psalm 91 says, does bystolic cause slow heartbeat? Yeah, I mean, bystolic is basically an alpha and a beta blocker. What is the normal heart rate dangers of slow heartbeat? What is the normal heart and dangers of slow heartbeat? It can lead to a bundle branch block, okay? This is pretty deep. Psalm, if you would like to do a consult, email me at ironladydoc@aol.com. If you guys want to know about healthy diets and exercise routines, I can do that too. You can do a consultation by emailing me at ironladydoc@aol.com. If you want help on your sleep apnea, email me at ironladydoc@aol.com and we'll set up a consultation. There's some questions that are very complicated and it would take a lot of explanation to even do one topic like what you guys are asking. Same thing with MADHAV and lowering inflammation. What caused the inflammation? What caused the free radicals? Food is the biggest source of all of these things. And thanks for the hearts, you guys. I appreciate that. And lets me know that you're loving the content. Why does iron have to do with sugar or glucose? Why does iron? I was talking about what we're feeding our pathogens in our body. They love to eat iron. When it's trapped in our bloods or in our tissues, it's all in the wrong place. It's called iron dysregulation. If you feed pathogens glucose, they're going to grow and multiply, okay? Madhav, if you want the price of the consultation, I have a 2-part payment for the protocol for the consultations. There's a part 1 and a part 2. The part 1 includes me reviewing all of your labs and your history. That takes me a couple of hours. I do that on my own after I receive your payment. And then I send you a report of my findings. If you want a consultation after that, which is part 2, then you schedule a video consultation with me and we will go over the report of information. I have most people, they pay for part 1 and they also pay for part 2. There are some people who only pay for part 1. They want the report and then they do all of their, they look up everything on their own. If down the line they want to go over it, they're always welcome to come back and schedule a video consultation. So I don't force, if I go and do all my research and then write you a report, I do not force you to do a video consultation with me to go over it. You don't have to do that. Most people do want me to do that because it can get complicated, and they've read the report and they formulated a bunch of questions and they want those questions answered. I will not answer questions via email in regards to the report. That requires a consultation, or I'll charge you another part 1. And, every time I answer a question, then I send you a bill, kind of like what an attorney does. Now, if you're okay with that, great. You don't want to have a consultation, video consultation, that's fine. Okay. If you would like to know my charges, email me at ironladydoc@aol.com. Madhav, am I into endocrinology? I am into metabolic dysfunction. I'm a family practice doctor, and I'm located in Iowa, board certified family practice. I went to an osteopathic medical school. I took an MD residency and I took MD boards. My specialty is family medicine. I do not have an endocrinology certificate, although I have studied metabolic medicine. That is my subspecialty, is metabolics. Okay. All right, if there's no further questions, we will call it quits today, and we will be back, Lord willing, next Saturday at 9 a.m. Central. You're very welcome, Madhav. I appreciate you. Yeah, even epistemic forge, even the doctors that do have the actual qualifications doesn't really make them experts, okay? Nothing makes me an expert. I read just like you guys can read. We are on this journey together. I don't claim to know everything. My goal in doing some of these things is not just to simply just rattle off all the things, the answers that I think have problems with, okay? I don't know all the answers. I don't claim to know all the answers. I am learning. Every day I learn something new, and I want to share it with you guys. It doesn't mean that everything I learn is truth. I don't know. All I can look back at is I used to believe this, and it didn't do so good for me, okay? People were still having heart attacks and strokes and diabetes, despite me following standard of care. And so then I start widening out my base and looking and jumping out of the matrix and start looking. Is there another possibility? And that's what is happening. I'm sharing all of the things of me jumping out of the matrix and say, hey, you guys, we need to question this. I don't know if this is right, but let's question these things, okay? Something is wrong here. If we have all of these medicines for cholesterol, shouldn't heart disease be done for? It would be gone. But we just keep making more medicines for cholesterol because that's the cause of heart disease. I have people who have a 20 LDL, and they're still having heart attacks. I mean, people with low LDLs are still having heart attacks. What is going on here? Is LDL the problem? I don't think so. And so we have to open our eyes and think logically. I mean, they feared us so bad into thinking that LDL is the cause of heart disease. Okay, seriously. We have been bamboozled. That's where I get this, bamboozled by the buffoonery. There is a bunch of intentional cognitive dissonance going on. And I'm trying to get you guys to start using your brain and look things up yourself. If I say something and you go, what? That doesn't sound right. Go look it up. Use your brain. Do not trust me or anyone else. I mean, I would hope that, I pray that I have good information and the information is truth. Okay, I do pray about that. I used to want to, if LDL was the cause, I thought I was doing something good for you guys. I really did. But when you started getting diabetes and your muscles were aching, you know what I said? Stick with it. Don't go off it. You're going to have a heart attack. If something happens to you and you go off of it, don't blame me. I told you to stay on it. That is medical gaslighting, and it's not right. I didn't really say it like that, but it must have sounded like that, okay? Like, I'm the one who knows it all. And I didn't know it all. I don't know it all. And I'm on a process along with you guys on a journey to research and learn things, okay? There's got to be another answer. Yeah, I agree. You do have to have a foundation. And even me, I had to start 4 years ago. I almost felt like I was going back to medical school. It was very hard. I felt very overwhelmed with all the information I was uncovering. I was going down rabbit holes and it was scary. But after 4 years, 5 years, 6 years, it's starting to connect the dots. It takes time. You guys can do this. You do not have to be a doctor. You don't have to be in the medical field. You can learn this stuff on your own, okay? You can learn it on your own. Adrian, to answer your question quickly, my shoulders were horrible and I was on a clean diet, meaning I ate hamburger and I'd have a half a piece of bun and I would eat salads and I would eat cottage cheese. And when I went off of every carbohydrate, straight up carnivore, no more crepitus in my shoulders, my range of motion increased, my body felt so much better. I will never eat plants. I drink coffee and that is about it. And I know I'm on a trial right now for a couple of months on macadamia nuts. My body hurts. It sucks. And it's not worth it. But I want to see my cholesterol panel and look at my lipid panel and see if it made any changes. Okay? That's the only reason I'm doing it. Cheesehead, I would love you to say a prayer before. Just whisper it, okay? God will hear it. When people pray in number over something, God is listening. Yeah, I know, Original K. You can learn it. Here's what I always say. I used to tell my patients, I go, try to put me out of business. Get so healthy that you do not need a doctor unless you need your fingers sewed back on, a hip replacement or something like you get in some crazy accident. That's the only time you should need a doctor. Otherwise, you should educate yourself. But there are a lot of people out there who are selling stuff. They sell everything. They work with your emotions. They'll sell you a certain type of toilet paper if you thought it would prevent you from having a heart attack. It's so thick out there. You do not need all of these supplements. You need to eat a proper human diet. You need to exercise. You need to pray. You need to get sleep. You need to go outside and get sunlight. You need to stand barefoot on the grass. You need to get away from all of the blue lights and the 5G and get off of your phones and start having family relationships. In fact, start having a family. These are the things that we need to get back on. We have been bamboozled and fear-mongered for way too long. And again, start with simply reading. I have you guys are emailing me and messaging me and say, hey, what do you think about this? I can't watch every reel or video you send me. But if I listen for a few seconds and I hear that they are trying to maneuver my brain, that's one of the things I really worked on, is all of the arguments that people use, whether it be ad hominem or authoritative arguments. I learned all of that stuff. That was one of the first things. I want to know, how are they manipulating my brain? What words do they use? How are they convincing me against my own sane world? I had to learn that part first, you guys. Then I used the wisdom of the Holy Spirit to help guide me on whether or not, hey, is this true or not true? But first, you got to avoid being manipulated. It is thick out there, okay? And even me, I'll hear something, oh God, that sounds such a wonderful thing. A special dental powder for my dogs, and it'll go from tartar on the teeth to completely white. And you get manipulated, and you go, whoa, step back. Is that even a possibility? Okay? So even me, I call it gullibleness, and then I have this BS meter. And when the BS meter starts going in the red, then I say, hold on, back off. They're messing with your logic here. Think through this. Do not make a hasty decision. Think logically. So I got to slow down. Okay? Yes, you should, Cheeside. You should do the same with my advice as well. What I do for me. I don't expect you to do for you. You guys are asking me, hey, what's the best diet? Well, the best diet for Dr. J is a ketovore diet with some coffee and some macadamia nuts and occasionally going out for a birthday dinner. That's how Dr. J lives. Do I expect everybody to live like me and it'll be successful just like me? It's like all of these carnivores out there. I listen to all the carnivores. I do. But they're missing something. If they tell you that it doesn't matter about your LDL being 500, that you are healthy, that you're never going to have a heart attack, that's BS. That's the BS meter going off, because I've seen it. I've seen carnivores have heart attacks. You have to look at those LDL sizes. You have to look at particle size. You have to look at the insulin level. You have to look at the inflammation level. You have to look at your blood clotting risk factors. Okay? There's so much more to look at, and it's going to take education of these carnivores to say not every carnivore can handle that much saturated fat. They can't eat sticks of butter. They shouldn't eat sticks of butter. And I use that lightly. I don't know if they're eating sticks of butter. What I'm saying is they can't have that much saturated fat, that much. And Sean Baker might be able to handle that much saturated fat, and he's fine. But somebody else, like whoever's listening right now on a carnivore diet with an LDL of 600, cannot handle that much saturated fat. Okay? Yeah, guess what? That's the truth. Kunal. Okay, you guys. Robbie, I did not forget about you, in case you're listening right now. Avo, I have not listened to Dr. Peter Attia, and Dr. Rhonda Patrick. I have not listened to any of that information. Okay. All right, you guys. So, Lord willing, I will be back next Saturday at 9 a.m. Central, Sunday at 10 a.m. Central. And in between, please check out my reels. I have not been doing one every single day because I want you to digest some of the ones I do. Like I did one on standard of care. I've done one on ApoB, and those hit home to a lot of people. And I think that we need to share this with others, okay? What do I think about coffee? I drink it. I like it. Could I give it up tomorrow? I could give it up tomorrow. I just choose not to. I don't want to give it up. Is it a neurotoxin? Could it be a neurotoxin? It's inflammatory. I think the oils in coffee, I think the way they grow it, I think it's got poisons and heavy metals just like anything else. And yes, I believe that there is a part of it that is a neurotoxin. Okay? It is sad. But then I will hear others say that it actually is a stimulant for your brain and that it actually helps your brain and your heart. So again, I wish I knew the truth. I don't. Okay. But I'm not going to tell you to stop drinking coffee if I don't drink it. And Lucy, please, thank you so much for being here. Even if you ended up being late, I really appreciate you. I really do. So hopefully you'll have a great day as well. And we'll talk soon. Okay, you guys have a blessed Sunday. See ya.